Hi guys, so welcome back. So it's been a while since I have recorded the chapter 3 that we had. So now we're gonna go to chapter 4. So our 4 will be talking about we will be talking about validating and documenting data. So this one is a very part of assessment too, a very important part of the um, of nursing process, because in this we're gonna do how to validate data. Okay, so this is the chapter 4. First, we will go to validating and documenting data. So ano ba to? As we go, we will learn about it. Okay, you remember Mrs. Gutierrez that we had before? So here we go again. So you met Mrs. Gutierrez in chapter 1 and learned how to interview her. So in chapter 2, we obtain all the additional data that we need. In this chapter, you will learn how the nurse validates, documents, and communicates data that we gathered from Mrs. Gutierrez. So sa chapter na ito, pag-aaralan natin tungkol sa kung paano i-validate yung mga data na nakuha natin kay Mrs. Gutierrez, tapos para i-document to, and paano natin to i-communicate sa mga ibang mga healthcare worker na involved sa pagkikare kay Mrs. Gutierrez. So, lahat yan pag-aaralan natin isa-isa. Okay? So, although validation and documentation and communication of data often occur with collection of subjective data and objective assessment. Minsan kasi, nagva-validate na tayo while we're doing the collection of subjective and objective assessment data. Pero kasi dito, kailangan natin isa-isahin para malaman talaga natin kung paano yung process nun. So, ngayon, unang-una is how to validate data. Okay? Unang-una, ano ba yung purpose ng validation? From the word itself, sabi dito, validation of data is the process of confirming or verifying that the subjective and objective data you have collected are reliable and accurate. So, these steps, syempre, nakalagay na nga sa word mismo validate. So, kailangan natin i-validate yung data na nakuha natin. Ano yung purpose nun is to make sure na yung data na nakuha natin is reliable and accurate. So, yun talaga yung pinaka main purpose nun. So, ito. The steps of validation include deciding whether the data require validation. Minsan, may data na tayo, titignan natin yun. Require pa ba natin to i-validate? O kaya naman, we have to determine ways to validate the data and identify the areas for which data are missing. So, failure to validate data may result in premature closure of the assessment. So, yun yung, kapag mali yung ginawa mong data, tapos hindi mo pa talaga nakuha yung tunay na problema, pwedeng ma-close natin agad yung assessment natin kahit kulang yung data natin, tapos mali pa yung data natin. So kailangan nating i-validate muna yung data. So errors during assessment cause the nurse judgment to be made on unreliable data, which result in, pag mali yung data na nakuha mo in assessment, pwede ito mag-result ng diagnostic error, or during the second part of nursing process, sa analysis ng data, mali yung magiging nursing diagnosis natin, collaborative problems, so pati yung referral, kasi mali yung data natin, doon na mag-uumpisa lahat. Alam mo yun, konektado kasi yan lahat. Thus, validation of collected during assessment of the client is crucial to the first step of the nursing process. So, this one is a very crucial part of the nursing process. So, data requiring validation. Ano ba yung mga data, ma'am, na kailangan natin i-validate? So, andito yan. So, not every piece of the data you have collect must be verified. Not everything. Yung example lang, you would not need to verify or repeat the client's pulse, temperature, or blood pressure unless, may nakalagay dito word, unless certain condition exists. So, condition that require data to be rechecked and validated include, so andito sa listahan, yung mga, ano ba yung mga data na kailangan i-validate pa? Example, yung mga data na may discrepancies or gaps between the subjective and objective data. So, for example, we have a male client that tells you that he is very happy despite that he has terminal cancer. Kaya kakarinig yan na may terminal cancer siya pero sobrang happy niya. So, parang may something wrong. Next one, discrepancies or gaps between what the client says at one time versus another time. So for example, you have a female client says that she has never had surgery, but later in interview, she mentions that her appendix was removed at a military hospital when she was in the Navy. So, yun, I have also some certain client na ganun din. Nakalimutan nila na meron silang um, surgery pala. Sa sobrang tagal na kasi hindi nila naisip in way back 19 kopong-kopong pa, hindi nila na babanggit na, ay, meron pala ako ganitong surgery. So, importanteng malapit natin yun as a nurse. Kasi, importante yun kasi minsan, katulad, I have a client na meron siyang MRI, pero plain lang naman. Pero kasi, pag nag-MRI ka, kailangan malaman nila kung meron ka mga previous surgery or kaya may mga previous implant para maiwasan natin yung mga unwanted na pwedeng mangyari while doing the MRI. Yung isang client ko, meron siyang parang but autocardioversion sa heart. Yung parang automatic siya na basta kapag kunyari may abnormality sa heart, automatic siya ino-normalize na yun, parang ganon. So, meron siyang ganun. So, hindi siya pwedeng mag-MRI kasi hindi siya compatible sa test na yon. Hindi pwede. Okay, so, ito naman, another one na pwede nating kung kaya natin dapat i-validate yung data. Findings that are highly abnormal or inconsistent with other findings. So, for example, the following are consistent with each other. The client has a temperature of 104 degree Fahrenheit, is resting comfortably, and her skin is warm to touch and not flash. So, minsan may problema yung mga debaterya ng mga machine, like the thermoscan itself. Pag nilagay mo dito, minsan meron akong thermoscan dati, lahat talaga ng kuha niya puro 38 degrees Celsius, which is not correct. Kailangan mo kumuha na another thermoscan at i-repeat yun. So, ganun yung pwede mong gawin para at least to make sure na tama yung data na nag-gather mo. Minsan naman dito lalagay mo 37.7, tapos sa kabila 38.1 na pala. So, pag mga ganun na alam mo nang malapit na, alam mo yung nasa borderline na ng fever, recheck mo. Kasi pwede kasing iba dito, iba sa kabila. Recheck mo, and then if it's not pwede kang gumamit ng ibang thermoscan just to validate. Okay? And then, another signs and symptoms na pwede mong makita, like, kung may flushing ng skin or warm to touch, yun, pwede mong makonclude, na may fever talaga. Minsan din naman kasi, minsan yung room ng pasyente sobrang init, kaya minsan nag-iiba din yung, test ng temperature. Pero make sure na i-validate natin. Kaya nga tayo may validation ng data. Kailangan i-make sure natin na tama yung nakuha nating assessment. At saka yung data ng assessment. So, methods of validation. So, we have here a lot of methods of validation. So, there are several ways to validate your data. You have to recheck your own data through a repeat assessment. So, pwede mo siyang i-repeat. For example, take the client's temperature again with different thermometer, katulad nga na sinabi ko kanina. And then next, clarify data with the client by asking additional questions. So for example, if a client is holding his abdomen, the nurse may assume he is having abdominal pain when in fact, the client is very upset about the day's diagnosis and feeling nauseated. Kasi minsan may mga ganun, di ba, parang pag may narinig kang masamang balita, parang masusuka ka. Or depende, case-to-case basis kasi yan. May iba naman na ako para ako masusuka kapag, alam mo yung na-stress ako. So, para ako masusuka pero hindi naman sakit yung tiyan ko. Feeling nauseated. So, hindi tayo pwedeng mag-assume na ganun. Kailangan natin tanungin si sir or si ma'am or yung client natin mismo. Verify the data with another healthcare professional. Walang masamang magtanong. If you aren't sure with your data, pwede kang magtanong sa another nurse. Kunyari, may mga katulad, minsan may client kami na hindi mo masyado marinig yung pulse rate or pulse beat. So, minsan kahit mag-sphygmomanometer ka, so minsan kailangan mo talagang ng tulong ng ibang nurses totoo bang wala kang marinig. Kasi ibig sabihin, kung wala kang marinig, baka patay na yung pasyente mo. So, kailangan mo tumingin ng tulong para mag-second opinion kung tama ba. Para at least, bago ka mag-reassess, bago ka tumawag ng residente or ng doktor, at least na-assess nyo ng dalawa, na-validate nyo dalawa na, ay, wala po talaga, Try na natin na isaksak sa cardiac mode para makita kung flatline na. So, ganun. Very, compare your objective findings with your subjective finding to uncover discrepancies. So, for example, if the client stated she never gets any time in the sun yet has dark, wrinkled, suntan skin, you need to validate the client's perception of never getting any time in the sun by asking exactly how much time is he spent working, sitting, or doing other activities out there. Also, ask what the client wears when engaging in outdoor activities. So, minsan kasi may mga client tayo na medyo iba yung perception nila. Kanya, for example, dito na nga, sinabi dito, yung client niya, may itim, may suntan skin, tapos wrinkled, pero sabi niya, hindi daw siya masyado nakakapang-araw. Tanongin mo kung ilang beses ba siya lumalabas, anong ginagawa niya outdoor, ano yung suot niya, para ma-validate talaga natin na talagang hindi siya talaga nagpapaaraw ng todo. So, yan yung mga methods ng validation. So, balik tayo kay Mrs. Gutierrez. So, Mrs. Gutierrez told the nurse she had a fever for the last 2 days. The nurse would need to take her temperature again to confirm whether she still had a fever. The nurse would also need to ask her if she took any medication for the fever that may must eat at this time. So, ganun pa rin. Kung may fever, kailangan i-check natin yung temperature. Pero, kailangan mo itanong din si ma'am or si sir na, sir, baka mamaya may ininom po ba kayo na gamot na pampababa ng temp bago kayo pumunta dito? Kasi pwede yung mamas yung true na result. So, yan. Next page. So, ito. Identification of areas for which data are missing. So, kailangan rin ma-identify din yung kung saang data tayo nagkukulang. Kasi minsan, may nami-miss din tayo. Kailangan din natin malaman yun. Hindi lang, sige, validate, kasi tapos may kulang ka palang data. So, once you establish an initial database, you can identify areas for which more data are needed. You may have overlooked certain questions. In addition, as data are examined in grouped format, you may realize that additional information is needed. For example, we have if an adult client weighs only 98 pounds, you would explore further to see if the client recently lost weight or this has been the usual weight for an extended time. If a client tells you that he lives alone, you may need to identify the existence of support system, his degree of social involvement with others, and his ability to function independently. So, dito meron ako example. Sa amin kasi, sa hospital na pinagtatrabuhan ko, kasi kung ang patient namin ay bumalik lang for like readmission, naka-admit na siya before, then mag-a-admit uli siya ngayon, meron na siyang record doon. So, minsan, pag in-input mo yung latest weight and height niya, lalabas na doon na yung previous na BMI niya, like the previous height and weight niya. Tapos malalaman doon na ganito yung way na ginain niya or way na nilost niya. So, yun yung maganda kapag continuous yung care. Kung same hospital ka pa rin, kung same ka pa rin, makikita mo pa rin kasi yung data mo para ma-compare. So, dito sa case study natin, kay Mrs. Gutierrez, the nurse would want to weigh Mrs. Gutierrez and call her doctor's office to ask for her weight at her last primary care provider's visit. She said that her clothes are loose. Since she said that her clothes are loose and no longer fit, so pwede mo yung gawin kung may number ka naman ng previous niya na doctor or kanyang previous na hospital or clinic, pwede mo rin itanong para ma-verify mo kung meron nga talagang weight loss or weight gain. This would also provide additional data to assess how severe her anorexic state was at this time. Kasi diba nga yung problema nga daw ni Mrs. Gutierrez ngayon, hindi siya masyado makatulog, hindi siya masyado makakain. So, documenting data. So, tapos tayo mag-validate. What we're gonna do? So, we have to document the data. So, documentation data, ito, depende to. Kasi mayroon tayong sinusunod na policy sa hospital. Depende kung anong standard yung sinusunod nyo. For example, sa hospital na pinagtatrabuhan ko, JCI kasi, so yung mga documentation namin based on JCI. So, yung Joint Commission on Accreditation of Healthcare Organization, meron din natawag na Medicare, Medicaid, so professional organization, either local, state, and national. So, depende yon sa hospital na pinagtatrabuhan mo. Institutional agencies, yung meron silang specific standard to address documentation for assessment. So, yan. May mga talagang, sila, parang official or mga, not official, but standard na mga document na ginagamit for their assessment. So, healthcare institutions have developed assessment and documentation policies and procedures that provide not only the criteria for documenting but also assistance in completing the forms. The categories information on the forms are designed to ensure that the nurse gathers the important information. So, it was, lahat naman ng document na ginagamit natin is usually to ensure that we gather the right information. So, no matter what, kung anong klase man yung sino man yung tawag ito, kung anong local organization or institutional agency yung sinusunod nyo, yun na pa rin ba naman yung purpose na ni is to gather the important information that you need for assessment. So, we have here, ano ba yung purpose ng assessment documentation? So, ano nga ba? First thing, it provides chronologic source of client assessment data and a progressive record of assessment finding that outline the client's course of care. So next, it ensures the information about the client and the family that is easily accessible to members of the healthcare team, provides a vehicle for communication, prevents fragmentation, repetition, and delays in carrying out the plan of care. So nabanggit ko nga, syempre document yan. Yung mga document na sinulat niyo dyan, yung mga assessment na nakuha mo, iikot yan sa buong healthcare team na nagpo-provide sa patient. Siyempre, doon sila makikita kung ano yung mga nagawa na mga labs, nakikita nila yan doon, para hindi na sila mag-repeat. Ma-avoid din yung delay ng carrying out the plan of care. Kunyari, may mga plan na sila na procedure para sa patient, as yung isa mag-order uli ng ganun. Siyempre, hindi na, kasi nakita nila, ay, na meron na pala. So, yun. Hindi na mag-repeat. Tapos, hindi na rin madidelay. Clearances na lang kailangan nila or what. Depende sa kanilang order at kung anong plano nila sa pasyente. So, ang purpose ng assessment documentation is to establish as a basis for screening or validating proposed diagnosis, and it also act as a source of information to help diagnose new problems, offers a basis of determining the educational needs of the client, family, and significant others. So, dito mo rin kasi yung malalaman eh. And also, it provides a basis for determining eligibility of care and reimbursement. So, careful recording of data can support financial reimbursement or gain additional reimbursement for transitional or skilled care needed by client. So, minsan talaga, importante talaga yung mga assessment na nakuha natin kasi minsan dun nagbe-base, not minsan, like always, dun sila nagbe-base din kung marireimburse ba sila ng mga insurance company nila. Kasi minsan may mga insurance company na pinipili lang ng mga sickness or diseases, hindi lahat covered. So, importante yung mga assessment natin. At malay natin, baka may mga iba pa doon na makatulong kay client na makabawas pa sa bayarin niya. So, constitute a permanent legal record of the care that was or was not given to the client. So, importante yung assessment data kasi dinidocument yon dahil ito ay isang legal paper. Dito makikita nila kung talagang ginawa mo yung care na para talaga sa kanya at kung hindi mo nagawa. So, napaka-importante sa nurses notes nyo, lahat ng ginawa nyo, isulat nyo. Okay? Para at least talagang kinare mo talaga yung pasyente. Kapag in the future, kung ano man, forms a component of client acuity system or client classification. Numeric values may be assigned to various level of care to help determine the staffing mix for the unit. So, napaka-importante rin na malaman natin kung ano yung assessment natin, kung anong level of care yung pasyente. Kasi para kapag pag mga nurses nag-shifting na, i-endorse na, maalam ng charge nurse kung kanino ibibigay yung mga pasyente na kailangan ng mas level of care. Kunyari, pag level 4, syempre, bibigay niya yun sa mga nurses na senior. Pag level 1, level 2, bibigay niya sa mga nurses na junior o mga bago para at least yung level of care balance. Pero hindi lahat ibibigay sa senior, lahat ng mga mabibigay. Syempre, i-share naman, i-balance yan. I-mix-mix. May mabigat, may magaan, para hindi lahat ganun yung charge nurse. Provide access to significant epidemiologic data for future investigation and research and educational endeavors. So, pwede din gamitin yung mga na-assess natin, yung mga assessment na data for future purposes, like for future research, education, investigation, yan. So, napaka-importante. And also, it promotes compliance with legal accreditation, reimbursement, and professional standard requirements. Just like what we have tackled. Okay, so yan na yung mga reason. Next, so pag-aralan natin yung tinatawag na EMR tsaka EHR. So ito, in the future, gagamit na talaga tayo nito. Although sa mga ibang hospital, gumagamit na. Like in our hospital, we are using already an EMR. So, we're using an IBAN to document and to plot and to validate our medication. Doon na rin nakalagay kung ano yung mga gamot ni patient, tas doon mo na rin ipa-plot kung nainom niya, anong reason ba't hindi nainom, ganun. So, there are two terms about it. So, we have the electronic health record and electronic medical record. So, usually, they are usually often used in place of each other, pero magkaiba yan. Actually, however, they present two different forms of electronic documentation. Unang-una, yung EMR, which existed before the term EHR. It refers to the medical records supplied by physicians who made medical diagnosis and prescribed treatment. So, nandiyan lahat yung mga gamot. And then, the more recent one, the term EHR, is more commonly used as it refers to the more comprehensive health status of the client and not only the medical status. So, thus the EHR may be used by a variety of healthcare providers such as physicians. So, the EHR focus on the total health. So, we have here the emotional, physical, social, spiritual of the client and are designed to reach out beyond the health organization that originally obtains the client data, such as dietitian, kasi pwedeng gamitin yung dietitian, physical therapists, laboratories, other specialists to promote collaboration of all those involved in the client's care. Thus, EHR provides nationwide access to the client information complied from data collected by a variety of healthcare providers. So, lahat doon, lahat makikita na doon, like mga labs, result ng patient, kung ano yung mga iniinom niyang gamot, mga assessment niya, like the review of system, lahat nandun na, biographical data, na, depende yan kasi, for example, in Switzerland, they have meron sila dong, sa Geneva, I forget the name, medical dossier, I don't know, I forget the name, pero meron silang parang, doon, pwede kang mag-register para i-record yung medical record mo, medical data, lahat. Tas depende sa'yo kung gusto mong i-access yun ng lahat ng kasama sa healthcare team or gusto mo i-access lang yung pag-emergency o kaya kung gusto mo, pwede mo siyang i-modify kung pwede mo siyang i-access, yung makaka-access lang nyo, yung main attending physician mo o kaya naman, bahala ka kung anong i-modify mo, basta pwede mo siyang ipa-access, especially sa mga taong involved sa care mo. Kasi para pag may emergency, instead na kung hindi ka nga hindi ka nila ma-interview, hindi ka makapag-set, pag nakita nila yung PIN number mo and then yung healthcare card mo, pwede nilang ma-access. So, depende pa rin yun sa consent na binigay mo. Depende yun sa'yo kung pwede mo kasing i-modify yun. Customize. Yun. According to what you need, what you want. So, ito, EHR are rapidly becoming part of the daily practice of the bedside nurse for documenting client data. Meaningful use of the EHR implies electronic documentation will improve the quality, safety, efficiency of client care while reducing disparities. It also means that the patient and their families will be actively engaged in their care and treatment through electronic communication. So right now, sa panahon ng COVID, uso na yung telecommunication, telemedicine or teleconsult. Instead of going to the hospital, you can just, if hindi naman emergency or hindi naman urgent, you can just do the teleconsult or telecommunication, which is more proficient kasi hindi mo na kailangan mag-travel and more safety kasi hindi mo na kailangan, more safe, hindi mo na kailangan mag-travel and ma-expose pa sa labas kasi we don't know, asymptomatic people can be also a carrier ng virus. A study of 16,362 nurses working at 316 hospitals across the United States revealed that the nurses who uses EHR systems had fewer reports of unfavorable client safety issues, medication errors, and low quality of care. The nurses also had a 14% decrease in reported that the data was missing or lost when clients were transferred between units. So, syempre kasi naka-documented siya sa computer, so hindi siya basta-basta mahulog at wala ng papel, pwede mawala or what. The use of EHR may allow for more comprehensive reports and discharge summaries to other healthcare providers by facilitating seamless transition for clients throughout the healthcare continuum. Meron din continuity of care kasi nandun na lahat yung data. Malalaman na nila, pwede nilang ma-compare and everything. So, sa amin, usually, meron na kaming parang mag-start pa lang. Yung parang computer table, may computer, then table, and then sa ilalim may mga medication box na gagamitin ng bedside nurse. Kasi dun ka na magpa-plot lahat. Even your charting, you're gonna do it there, your everything. So, yun. Baka maybe this year, maybe next year, baka may implement na yun or magamit na. Hopefully. Kasi parang baka ma-less na yung mga papel namin na susulatan, or mas better na mawala na. Kasi kung may computer din naman, dun na lahat. So, mas easy, mas mabilis, at mas safe. Tsaka mas eligible. Kasi katulad sa akin, di gano'ng kagandahan yung sulat ko. Anyway, so balik tayo kay Mrs. Gutierrez. So you may recall that Mrs. Gutierrez's husband, 60 years old, was in a car accident 2 months ago. When this occurred, the nurses in the emergency department were alerted before he arrived at the hospital about his injuries. The name of his primary healthcare provider, his Medicaid status, his blood type, and that he was currently taking these prescribed drugs: warfarin, metoprolol, lisinopril, and metformin. Both a healthcare smart card and an EHR were used to transfer this data to the nurses at the hospital. The nurses were able to have the medications ordered from the pharmacy and equipment needed for the prompt treatment of Mr. Gutierrez when he arrived at the emergency department. So, this will be, kung as you can see, di ba, ang bilis na kasi makikita na agad nila, wala pa si Mr. Gutierrez sa emergency department, pero nalaman nila yung pangalan, madali nila ma-access yung data, especially kung meron ng, alam mo yun, nandun na yung mga status niya, ano yung blood type niya. So, kung alam natin kung may problema siya kung may siya, madali nang makuhaan ng dugo or what. Kasi meron na tayo, alam na natin yung data niya. And then, alam natin kung ano yung mga prescription or mga drugs na ginagamit niya. So, mabilis na natin ma-order rin sa pharmacy kung kailangan pa ni patient. So, yun ang kinaganda nun, na access mo lahat ng data. So, may mga pros and cons din naman. Pero, syempre, lahat gagamitin natin sa pros. Pros. Okay, so information requiring documentation. Ano ba yung mga information na na-require na document natin? Siyempre, napaka-importante talaga yung subjective, objective data. We have already talked about it a lot of times from previous one, from chapter 1 until now. Puro na lang tayo, subjective, objective, talagang mapupuno talaga kasi we're talking about health assessment. So, laging nandun yung subjective and objective data. So, any chapter yata dito, mababanggit pa rin talaga natin. Okay, so, ano nga uli yung sa subjective data? Naku, paulit-ulit tayo dito. Like, really, paulit-ulit talaga. Ano nakalagay dito? So, subjective data typically consist of biographic data. Yung present health concern. Siyempre, sa present health concern, dito i-record natin. Nandito naka-record yung mga statement na nagre-reflect dito yung mga client's current symptoms. So, usually, yung statement nila should begin like client, states, client, verbalize, ganan. So, yan. Digamit din tayo ng cold spa. Mamaya, sa next chapter, sa next page, makikita natin kung ano yung cold spa. Actually, I have talked about it na before. Pero review lang to, as in like, ulit-ulit na lang. Tapos, ilalagay din natin na kailangan natin i-record din yung absence ng specific signs and symptoms. Kailangan din natin ilagay na no vomiting, no diarrhea, or constipation noted, ganan. So, yan. Pwede mo ilagay yan. And then, personal health history. So, it tells the nurse about events that happened before the client's admission to the healthcare facility or current encounter with the client. So, yan. Dito makita natin yung mga data na kailangan malaman natin, like yung dati niyang surgeries, previous hospitalization, treatment program, acute illness, chronic illnesses, injuries, allergies, medication, over-the-counter. Be sure also to include ibang mga information like kailangan kahit yung negative like the client denies prior surgery. So, importante rin ilagay yun kung wala naman para at least alam mo yung nakalagay, naka-indicate. Family history, kailangan din nakalagay din doon yung include information about the client's biologic family. Yung genogram, remember, we have talked about genogram. It may be helpful in recording family history ng mga sakit. May mga familial genetic history sila. So, yun. Next naman, lifestyle and health practices information includes detail about risk behavior. Kunyari, yung pasyente merong poor nutrition. Ma'am, ano ba yung poor nutrition? Ibig sabihin ba kulang? Hindi. Ang poor nutrition, it can be either excess or deficiency ng or deficit ng kahit anong nutrients or sobra-sobra. So, yan. Pwedeng maging poor nutrition yun. Excessive sun exposure, past or present smoking, alcohol use, illicit drug use, unprotected sex, lack of exercise, sleep, recreation, leisure activities. So, additional data collected includes environmental factors that may affect health, social, psychological factors that may affect the client's health, client and family health, education needs, and family and other relationships. So, be sure to be comprehensive and yet succinct. So, yan. Next page. Ayan. So, ito yung case study natin. Nandito yung lahat ng mga assessment na kinuha natin tungkol kay Mrs. Gutierrez. Ay, sorry. Ayan, I'm just checking ba kasi mamaya wala na namang on yung microphone ko. Salita ako ng salita dito tapos wala na naman. So, chine-check ko lang. Baka kasi mamaya, Ayan. So, meron naman. Naka-on naman. Okay, so case study, we're gonna talk about Mrs. Gutierrez. So, andito na yung mga assessment na nakuha natin. So, example natin talaga si Mrs. Gutierrez. Hanggang sa matapos tong libro na ito, nandito si Mrs. Gutierrez. So, bear with me. Si Mrs. Gutierrez, remember, is a 50-year-old female who was born in Mexico City and moved to Los Angeles when she was 20 years old. She has been a homemaker all of her adult life. Her daughter has dropped her off at the clinic while she runs some errands. She lives with her husband and 3 daughters, ages 12, 14, and 17. She has 2 older sons who are married and lives in Mexico. She shares a cell phone and a car with her oldest daughter. She completed high school in Mexico. Mrs. Gutierrez's family does not have private health care insurance. Mrs. Gutierrez states that she has to come to the clinic because her doctor told her she needed diabetic teaching. However, her concern is, I cannot eat or sleep and I just want to be able to eat and sleep again. Mrs. Gutierrez's symptoms of lost appetite and ability to sleep were further explored using cold spa. So, ano yung cold spa? Cold spa. So, character. Describe the nature of your inability to sleep. Di kasi yung chief complaint ni patient, di ba? So, describe your current appetite by telling what you eat in normal days. So, ito yung respond ni sa isa natin yung respond ni Mrs. Gutierrez. So, I only sleep 4 to 5 hours. Once I fall asleep about 10 p.m., I wake up about 2 a.m. or 3 a.m. and I cannot go back to sleep. I do not take naps during the day. I eat cereal in the morning, but I'm not able to eat much the rest of the day. I eat less than 1/2 of what I used to eat. I still try to cook but find it hard to stay focused. I only eat 1 bite of tamale and maybe a bite of 2 beans of rice. So, yan yung kinakain ni Mrs. Gutierrez. Wala siyang gana. Tapos, nagigising daw siya. Pag nagising siya ng alas 2 hindi na siya makabilik sa pagtulog. Onset. Kailan ba ito nag-umpisa? 2 months ago, right after my husband was in a car wreck, sabi ni Mrs. Gutierrez. Location, non-applicable. Duration, 2 months nga daw. Severity. So, ito yung sabi ni Mrs. Gutierrez. I'm so tired in the daytime that I have let my housework pile up. Sometimes I just lay in bed but I do not sleep. I know I should be eating but I do not feel hungry and food is not appetizing to me. Ayan. And then, what makes it better or worse? Sa P, letter P na ng cold spa tayo. I have tried taking Excedrin PM but it makes me feel more drowsy all day. I only drink a cup of coffee in the morning and stop drinking tea in the afternoon. My daughter has tried to fix my favorite food but I still cannot eat. So, associated factors. So, that's the A of the cold spa. Experiencing susto and states my clothes no longer fit and I'm very loose. I worry a lot as how to will pay our bills now that my husband had lost his job and we do not have health insurance. The other day, I began crying over nothing. I just feel sad all the time. So, yan yung pakiramdam ni Mrs. Gutierrez. So, after natin i-explore yung loss of appetite and ability to sleep using the cold spa, the nurse also continues to get the health history. So Mrs. Gutierrez doesn't have accurate record of childhood medical history but received updated immunization when she came to the U.S. at 20 years of age. No past surgeries or injuries, no known allergies, does not take any prescribed medication, but does occasionally use over-the-counter medication of Excedrin PM for sleep and Tylenol for headache. So, yun ang usually na ginagamit niya. Gravida 5 para 5 aborta 0. Gestational diabetes during her last pregnancy, was recently diagnosed with type 2 diabetes mellitus. So Mrs. Gutierrez has little knowledge of her family history, and she was abandoned by her parents as an infant and later adopted. The review system for Mrs. Gutierrez is as follows. So ito na, yung mga review of system. So sa skin, hair, and nails, no report of problems with skin, hair, or nails. So wala siyang problema siyan. Head and neck, denies headache, swelling, stiffness of neck, difficulty swallowing, sore throat, enlarged lymph nodes. Eye, reports that she wears glasses for reading, denies eye infection, redness, excessive tearing, halos around lights, blurring, loss of sight vision, moving black spots, specks in visual field, flashing lights, double vision, and eye pain. So wala siya nun. Ears, it denies hearing loss, ringing or buzzing, earaches, drainage from ear, dizziness, exposure to loud noises. So remember, di ba, kailangan mo ilagay din yun kung wala talaga. Denies, no reported, ganyan. Sa mouth, nose, throat, and sinuses. Client reports missing upper molars, denies bleeding of gums or other dental problems, sore throat, mouth lesions, harshness, rhinorrhea, nasal obstruction, frequent colds, sneezing or itching eyes, ear, nose, throat, nosebleed, snoring. Wala siya nun. Next, thorax and larynx. Denies difficulty breathing, wheezing, pain, shortness of breath during routine activity or topnia, hemoptysis, respiratory infection, reports dry to productive cup of Krispy Kreme in the morning upon waking. So, yun meron siya. Breast and inguinal and regional lymphatics. Denies lump or discharge from nipples, dimpling or changes in the breast size. Denies swollen or tender lymph nodes in axilla. Heart and neck vessel. Client reports last blood pressure was 130/84, denies chest pain or pressure palpitation. Peripheral vascular, denies edema of legs or feet, pain, cramping, lesions on legs, color, texture, changes of legs or feet. Abdomen, describes lack of appetite. So we have our 24 dietary recall. Mamaya, makita natin yan. Denies difficulty swallowing, nausea, vomiting, gas, jaundice, hernias. It must be skeletal, denies erythema, pain or stiffness of joints, denies weakness, reports ability to perform activities of daily living without difficulty. Neurologic, sequels pa. Denies feeling of anger or suicidal thoughts, denies concussion, headache, loss of strength or sensation, lack of coordination, difficulty of speaking, memory problems, strange thoughts or actions. Next page. Sa female genitalia, ano meron sa kanya? Denies sexual problems, sexually transmitted infection, dribbling or incontinence, menarche age 13, menopause at age 51. Denies pelvic pain, use of oral contraceptives, and use of hormone replacement therapy. Anus, rectum, and prostate. Reports having a daily bowel movement of form brown stool. Denies pain with defecation, hemorrhoids, blood in stool, constipation, and diarrhea. So, ano kaya yung lifestyle and health practice profile ni Mrs. Gutierrez? So, Mrs. Gutierrez reports that she gets up at 6 a.m. every day, does laundry and homework, begins to prepare meals for the day. She enjoys working outside but has not been able to do as much as she did since her husband's accident. She used to attend the 7 a.m. mass service at her church but has not done so recently. She talks with her sister in Mexico once a week. Bedtime is usually after the news at 10:30 p.m. 24-hour dietary recall. So we have it here. Breakfast, small or 4 ounces, bowl of oatmeal with milk and sugar. Lunch, plain tortilla with a glass of milk. Supper, a few bites of chicken and rice with a glass of water. Currently, her daughter does all the grocery shopping that she used to do. Client does not typically eat at restaurant. So here, when feeling well, client does all the housework and gardening by herself. Denies any participation in a regular aerobic exercise routine. She likes to attend the dinners and church and bingo on Friday nights. Does not drink alcohol. Used to drink 2 to 4 cups of coffee a day, but she has stopped in order to help her sleep. Denies the use of tobacco products, occasional drugs to complement her alternative medication. She describes her talent as being good mom and housekeeper. I used to be pretty, but do not feel like taking care of myself. My husband and I used to have a good relationship, but we do not spend much time with each other anymore. I do not thrive. My daughter takes me where I need to go. See primary care provider annually and goes to the eye doctor whenever her prescription needs to be changed. Reports frequent feelings of loneliness with her siblings and parents living so far away in Mexico. I worry a lot, especially since my husband had an accident and cannot work. We were planning a trip to Mexico to see my family and now we cannot go because we do not have enough money. I used to pray when I worried, but that doesn't seem to help anymore. His accident was such a shock to me. Client lives in a 3-bedroom home, states that there are often neighborhood fights outside, but she and her husband do not get involved. Feels fairly safe but worries about the neighborhood sometimes. So, ayun. Tapos na tayo sa subjective data. So, ang dami-dami nun. Like, yun yung pinaka-review of system. Ganun kumuha ng assessment. Pag talagang, dito, yung kukumpletong assessment na ginawa. So, dun ilalagay mo kung meron or wala. Pwede mo lagay i-denies, not noted, reported, ganyan. Verbalized, so yun, fully stated, yung patient state, client state. So, lahat na nakuha mong information. Objective data. After you complete the nursing history, the physical examination begins. So, dito nag-include na yung inspection, palpation, percussion, auscultation. Naalala nyo dati, yung ating ginawang physical assessment. This data also help to further define the client's problem, establish baseline data for ongoing assessment, and to validate the subjective data obtained during the nursing history interview. Kasi, pag kung ano yung nakuha mo sa subjective data, pwede mo siyang i-validate using the objective data. So, kahit anong approach yung gamitin nyo, ito dapat yung sundin natin na general rules. Okay? First one, make note as you perform the assessment and document as concisely as possible. So, napaka-importante nun na mag-make note ka. Ako makakalimutin ako, kaya lahat sinusulat ko. Kaya may nakuha kong mga information na sa pasyente, like nakuha kong mga data, isusulat ko yun. Especially pag numbers na ko, makakalimutin ako. So, kailangan ko yung isulat. So, lagi akong may clipboard and then may ballpen and pen. May ballpen, pen, or paper para sulatan. Avoid documenting with general, non-descriptive, or non-measurable terms such as abnormal, good, fair, satisfactory, or poor. So, ina-avoid natin yan. Mas maganda na ilagay talaga yung nakuha mong data. Kung may number or may sinukatan ka. Yun ang mas okay. Instead, use specific, descriptive, and measurable terms. Yun ang sinasabi ko. Like, for example, 3 inches in diameter, red excoriated edges with purulent yellow drainage, about what you inspected, palpated, percussed, and auscultated. So, lahat ng info, like, descriptive siya. So, ito yung mga guidelines for documentation. Paano ba i-document yun, ma'am, ng maayos? Siyempre, you have to keep confidential all documented information in the client record. So, napaka-importante na lagi yung confidential. Most agencies require nurses to complete the Health Insurance Portability and Accountability Act 1996. Ito yung para to ensure that the training to ensure that the use disclosure of requests for protected information is used only for intended purposes and kept to a minimum. Yan. So, syempre, dapat i-educate din natin yung client about their right regarding sa Health Insurance Portability and Accountability Act. Ewan ko sa US to eh. Dito sa Pinas, hindi ko masyadong alam kung ano yung tungkol dun. Yeah. So, importante rin na we have to document legibly. Hindi ako magaling dito. Legibly or print neatly in a non-erasable ink. So, usually, pag may errors in documentation, we usually correct it by drawing one line, then lalagyan mo ng initials, and then pirma mo. Tapos lagyan mo ng error sa taas. Ayun. Kasi ibig sabihin, mali yun. Parang isang line lang. Hindi mo kailangan i-erase ng boom, 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 boom. I-erase ka ng ganun. Never obliterate the error with white paint or tape. Bawal yun. An eraser or marking pen. Bawal yun. Keep in mind that the health record is a legal document. Use correct grammar and spelling. Use only abbreviations that are acceptable and approved by institution. So, meron kasi mga word na hindi dapat gamitin or mga abbreviation na hindi na ginagamit. Depende sa hospital niyo yun na policy. Kasi minsan nakaka-cause yun ng confusion. Avoid slang, jargon, or labels unless they are direct quote. Avoid din natin yung mga slang words, yung mga jargon, or mga label. Kasi pwede natin isulat yun pag in-state mismo ng pasyente. Pero pag yung ikaw yung sulat na galing sa sayo, hindi. Yun tama. Avoid wordiness that creates redundancy. So, for example, You do not record auscultate gurgly vowel sound in right upper, right lower, left lower abdominal quadrant. Heard 36 gurgles per minute. Hindi naman tama na ilagay mo yung lahat. You can also just record it like vowel sound presence in all quadrants at 36 per minute. Ganon. Use phrases instead of sentences to record data para mas mabilis. Like for example, avoid recording the client's lungs not were clear both in the right and left lungs. So instead na sulat mo yun, i-record mo na lang na bilateral lung sounds clear. So di ba? Much precise. Short but precise. Okay. Record data findings. Clients what so not how they were obtained. For example, do not record. Client was interviewed for the past history of high blood pressure and blood pressure was taken. Instead, record has 3-year history of hypertension, treated with medication, BP sitting right arm 140/86, left arm 136/86. So, you also have to write entries objectively without making premature judgment or diagnosis. So, bawal kang magbigay agad ng mga premature na hindi ka pa nga sure. So, use quotation mark to identify clearly the client's response. For example, client crying in room, refuses to talk, husband has gone home. Instead of client depressed due to fear of breast biopsy report and not getting along well with husband. So, bawal tayo mag-assume. Mga premature na mga assume natin. Okay? Avoid making inferences and diagnostic statement until you have collected and validated all data with clients and family. Record the client's understanding and perception of problems. So, for example, you have to record client expresses concern regarding being discharged soon after gallbladder surgery because of inability to rest at home with 6 children. So, yan. Pwedeng ganon. Ito. Dito tayo. Ito, i-avoid din natin. Sorry. Avoid recording the word normal for normal findings. For example, di ba sabi ko nga sa inyo, do not use that. For example, do not record liver palpation normal. Instead, record liver span 10 cm in the right MCL and 4 cm in MSL. No tenderness on palpation. In some healthcare setting, however, only abnormal findings are documented if the policy is to chart by exception only. In that case, no normal findings would be documented in any format. So, example, sa hospital namin, gumagamit kami ng, hindi namin sinusulat yung mga normal finding kasi normal naman. Sinusulat namin yung mga abnormal finding. Kunyari, sa hand of worksheet namin, nakalagay doon yung existing problem. Fever, temp niya, ganito, 39. T-max ko, temperature maximum ko, 40. Ganun, doon mo ilagay. Tapos kung anong oras yun, anong date, nakuha yung ganun data. Kaya naman, pwede mo ilagay doon, kunyari yung hemoglobin niya mababa. Ilagay mo doon yung abnormal result. O kaya, yung magnesium niya, mababa. O kaya, serum sodium niya, mababa. So, ilagay mo doon yung abnormal na para alam ng kasunod mo na nurse kung ano yung existing problem ng pasyente. Okay? Hindi mo na kailangan isulat doon yung mga normal. O kaya, lagay mo doon pag BP niya mataas. Yung BP nito, 140 to 80 to 160-90, ganan. Lagay mo doon. Pero yung mga normal, hindi mo na kailangan ilagay. Kasi we are talking about kung ano yung problema sa pasyente at hindi yung, excuse me, hindi normal. Sorry. Okay. Okay. Now, we could also record complete information and details for all client symptoms or experiences. For example, we do not record client has pain in lower back. Instead, record client reports aching, burning pain in lower back for 2 weeks. Pain worsens after standing for several hours. Rest and ibuprofen used to take the edge of pain. No radiation pain. Rates pain as 7 on a scale of 1 to 10. So, ganun yung mga pwede mong i-record. Ito, include additional assessment content when applicable. For example, include information about the caregiver or last physician contact. Supportive objective data with specific observation obtained during the physical examination. For example, when describing the emotional status of the client as depressed, follow it with a description of the ways depression is demonstrated, such as dress in dirty clothing, avoids eye contact, unkempt appearance, and slumped shoulders. So, yan. So, ano ba yung mga forms na ginagamit for documentation? So, ito medyo gamit tayong forms. So, we have here like 4 klase ng form. Features of types of initial assessment documentation form. So, depende yan sa mga hospital. Iba-iba kasi. So, ito yung mga klase ng mga form. Una, we have the, lagay ko nga ito dito. Go here. Then, we have the open-ended form. Traditional form yung tawag na. So, it calls for narrative description of the problem, so and listing of topics. So, it provides lines for comments to individualize information. It provides total picture, including specific complaints and symptoms in the client's own words. Increases the risk of failing to ask a pertinent question because questions are not standardized. Requires a lot of time to complete the database. Ano naman yung queued or checklist form? So, yung open-ended parang narrative form. Tapos yung queued or checklist form parang, ano siya? Checklist, nandun na lahat. Standardized data collection, it lists or categorizes information that alerts the nurse to specific problems or symptoms assessed to each client. So, nandun yung sa figure 4:1. Mamaya makita natin yung next page. Usually, it includes a comment section after each category to allow for individualization. It also prevents missed questions, promote easy, rapid documentation, make documentation somewhat like data entry because it requires nurse to place check marks in boxes instead of writing narrative. So, yun lang. May pros and meron ring cons. Dito naman, poses chance that a significant piece of data may be missed. Yun yung cons niya. Because the checklist does not include the area of concern. Integrated queued checklist. Ano naman to? Ito, it combines assessment data with identified nursing diagnosis, help cluster data, focus on the nursing diagnosis, assist in validating nursing diagnosis label, combine assessment with problem listing in one form. It also promotes use by different level of caregiver, resulting in enhanced communication among the discipline. So, nursing minimum data set comprise says format commonly used in long-term care facilities, has a queued format that prompts nurse for specific criteria, usually computerized, includes specialized information such as cognitive patterns, communication, hearing and vision, patterns, physical functions, structural patterns, activity patterns, restorative care, and the like. Meet the needs of multiple data users in the healthcare system, establishes comparability of nursing data across clinical, population setting, geographical areas, and time. So, yun. Okay, so we go now here. And iba-ibang klaseng form. So, meron tayong assessment form used for documentation. We have the initial assessment form. So, ito yung tinatawag din na nursing admission or admission database. The frequent or ongoing assessment form, ito naman yung parang flowchart na that helps staff to record indicative data for frequent reassessment. So, example nito yung flowchart natin ng vital sign sheets, para doon yung vital signs, in graphic format, doon makikita yung visualization ng abnormalities or yung flow ng chart. Progress note, yan, may be used to document unusual event, response, significant observation, or interaction whose data are inappropriate for flow records. Makikita natin yan sa next page, kasi nandun yung mga figure na yan. Focus or specialty areas assessment form. Some institutions may use assessment form that are focused on one major area. For example, may assessment form tayo na para lang sa cardiovascular or neurological assessment documentation. Yan. Pwede yun din ilagay lang. Meron din concern like katulad sa fall or kaya skin problem. Di ba may mga binigay ko sa inyo example ng mga forms. Yan, nandun yung sa fall para sa screening tool, kaya skin problem. Kunyari pag may mga bed sore, may sukatan sila na klase ng papel. So, depende kung anong assessment form specifically made for that. So, ito yung example ng 4.1. Print out of computerized admission form. Ito yung admission form. Ayan. Sorry. Ayan. Leave alone. Yes or no. Lagay mo lang. Checklist. Tapos, kung may mga iba kang comment, ilagay mo lang dyan sa mga linya. Next, ito naman, for example, adult admission health history. Ito na parang narrative type. Lalagay mo yun dyan. Ito naman, ang assessment flow sheet. Kunyari, ito yung tungkol sa nutrition. So, continuous yan. Ito, kunyari, nakalagay dito, 23 to 7 o'clock. So, parang night shift. And then, ito, AM shift. And then, ito, PM shift. So, continuous. Respiratory, nandito rin. So, andito yung oras. So, yan. Parang continuous. Ito rin, ganun din. Ito naman, ganun din. Per shift. Ito mo ilalagay. Check, 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 and then comments. Next, ito ulit si case study natin. Si Ma'am Mrs. Gutierrez. So, nakuha na natin yan lahat. Nabasa na natin yan lahat. So, ito na yung pinakabuo niya. Next naman, dito tayo sa may, ito yung tinatawag na portions of a computerized screening flow sheet. The full assessment document includes set of systemic findings as well as functional data as nutrition, activities of daily, and client education needs. So, dito mo na i-input lahat. Type mo na lang lahat ng nakuha mong assessment. Okay? Computerized yan. Yan yung computerized screening flow sheet. Ito naman, ano ba yung verbal communication data? So, nag-validate na tayo ng data. Na-document na natin. So, ngayon, paano natin yun i-verbal communicate? Kasi documentation, more on writing, more on documenting. So, paano natin yun i-verbal communicate? Sa susunod na nurse o kaya sa mga nurses or sa mga ibang healthcare team. So, nurses are often in situation which they are required to verbally share their subjective and objective assessment finding. They must be able to report assessment finding verbally in an effective manner to other healthcare workers. So, this occurs anytime one healthcare provider is transferring client care responsibilities for the client's care to another healthcare provider. So, dito na yung papasok yung tinatawag na hand-off. So, pag nag-hand-off, sabihin hand-off worksheet, meron ka din nun, dun mo ilalagay yung mga data na kailangan pang i-continue of care ng next na bedside nurse, yan. O kaya naman mag-transfer ka ng pasyente, kailangan, syempre, iba na yung mag-aalaga sa kanya, kailangan mo i-verbalize yung endorsement na tinatawag. Endorse mo, verbally. Tapos, aside pa dun sa papel na ano mo, nakakasulat dun, i-verbalize mo yung mga, kailangan pa ng pasyente, lahat about sa patient. So, pwede rin na mag-hand off kapag merong, yun nga, shifting na ng nurses. Kunyari, night shift ka, endorse mo na sa AM shift. Yun. Kaya naman, pag break ka or break mo or meal, so, pwede mo i-endorse yun sa kasama na, pag tumawag, si ganito, may ganito lang, may ganito, may ganan, pakikaano lang, pakitanggal, paki-off naman, pakikuha naman yung IV, pakipalitan, ganan. So, yan, endorse pa rin yun. A client is transferred to another unit or facility, yan, kailangan mo pa rin i-endorse. O kaya naman, pag ang client leaves to their unit or a test for a test or procedure, kunyari, kailangan niya bumaba kasi andun yung CT scan, andun yung x-ray. So, yan, i-endorse mo rin. So, the more people that are involved in hand-off affirmation, the greater risk of communication errors. Diba nga kapag naglalaro tayo ng parang pass the message, pag mas madami yung involved na tao, mas prone sa error. So, kaya importante as a nurse na i-prevent natin yung communication error. So, paano? Andito yung list. Use a standardized method of data communication such as the S-bar. Mamaya, malalaman natin kung ano yung S-bar. Alam niyo na yan before because we have already talked about it. Communicate face-to-face with good eye contact. So, maganda kapag nakipag-usap ka, hindi ka nakatalikod sa kausap mo. Whether face-to-face, pero syempre kailangan may social distancing pa rin at you have to wear your mask and your face shield. Allow time for the receiver to ask questions. So, kung may tanong siya, hayaan nyo magtanong. Provide documentation of the data you are sharing. So, kailangan may documentation ka kasi syempre, saan yung basis mo, ano yung basis mo. So, validate what the receiver has heard by questioning or asking him or her to summarize your report. So, pwede mo siyang tanong or kapag naman pag mga telephone, yung endorsement nyo, ask the receiver to read back or that she heard your report or document the phone call with time, receiver, sender, and information shared. So, yan, kanya may galing sa ER, i-aakyat sa inyo. Siyempre, yung mga ER nurse, hindi naman yan naakyat para lang i-endorse sa'yo yun. So, they just may na-call ahead of time bago nila i-transfer yung patient para may idea ka na kung ano yung mga contraption ng pasyente, anong case, kamusta si pasyente, ano yung latest vitals, ano pa yung pending, ano pa yung gagawin. So, yun. Okay, it is important to report the assessment findings verbally in an effective manner to other healthcare workers. So, minsan din, pag nag-i-endorse, minsan nagkakaroon tayo ng physical endorsement. Yung pupunta talaga sa karoon ng pasyente, endorse mo kung ano yung contraptions na nandun, anong IV, anong line, anong meron pa, like kung meron folic catheter, may NGT, anong level. So, yun. So, maganda na ma-endorse nyo ng maayos. So, ito yung S-bar na tinatawag. So, S-bar, this is the situation, background, assessment, and recommendation. So, for example, for the situation, you have to state concisely why you need to communicate the client data that you have assessed. For example, Mary Lorno, age 18, experiencing a sudden onset of periumbilical pain. Background. Describe the events that led up to current situation. Example, client first noticed periumbilical pain at 10:30 a.m. She denies any precipitating factors. Assessment. State that the subjective and subjective data you have collected. So, for example, yung subjective natin is client rated pain as 7 to 8 on a scale of 0 to 10 at onset and now raised the pain as 3 to 4 on a scale of 0 to 10. She denies nausea, vomiting, and diarrhea. She voices anorexia. Eating and drinking exacerbates the pain and lying in niches position diminishes pain. Describe this pain as stabbing. Objective. Client is awake, alert, and oriented. She makes and maintains conversation, does not appear to be in acute distress. Temperature 98.7, pulse rate 72, respiratory rate 16, BP 112/64, color pink, skin warm and dry, mucous membrane moist, abdomen flat without visible pulsation, bowel sounds present and hypoactive. Abdomen tympanic. Upon percussion, abdomen is soft. Light palpation reveals minimal tenderness in right lower quadrant. Deep palpation reveals minimal tenderness in right lower quadrant. Robson sign is negative. Obturator sign is negative. No rebound tenderness noted. So, yun yung assessment. Recommendation. Suggest what you believe needs to be done for the client based on your assessment findings. So, example, suggest that the primary care provider come to further assess the client and intervene. So, yan. So, ano yung summary ng lesson natin? So, ang summary ng lesson natin, validation, documentation, and verbal communication of the data are the three crucial aspects of nursing health assessment. So, nurses need to concentrate on learning how to perform these three skill steps, thoroughly and accurately. So, validation of data, to summary lang to, okay? Validation of data verifies the assessment data that you have gathered from the client. It consists of determining which data require validation, implementing techniques to validate, and identifying areas that require further assessment data. Documentation of data is the act of recording the client assessment findings. Nurses first need to understand the purpose of the documentation. Next, learn which information to document. Be aware and follow the individual documentation guidelines for the particular healthcare facility. In addition, it is important for nurses to be familiar with the different documentation forms used in healthcare agency in which they practice. Finally, nurses need to know how to verbally communicate assessment findings in a clear, concise manner to other healthcare providers. So, that's it. So, here, when reporting over a telephone, importante you have to ask the receiver to read back what or he or she heard your report and document the phone call with time, receiver, sender, and information that shared. So, yan yun. So, I'll see you next time. We're gonna talk about the chapter 5, which is the thinking critically to analyze data and make informed nursing judgment. Thank you and goodbye. Good luck on your exam.